Invisible illness and invisible pain is something that as a society, people have been suffering with for way too long. And that is one of the reasons I founded Compleo. I'm Kelsey Baas, Doctor of Physical Therapy. And today I want to talk to you a little bit about what to look for if you have an Ehlers-Danlos Syndrome diagnosis, or if you think you might have Ehlers-Danlos Syndrome. How are you finding and putting together your medical team? And you need a medical team. You don't need just one person, because Ehlers-Danlos Syndrome is a connective tissue disorder, which means it affects every part of our body. And so you're gonna need specialists for every part of your body. That is something we treat a lot of in our clinic. And so what sets us apart with that? One, we're aware of it. I think that's one of the most important things, is first to validate that this is a real diagnosis and that your pain you've been feeling your whole life is real. It's not catastrophization or over-exaggeration. It is real pain that you've been feeling. Some things that research is showing, your fascia alone is different when you have an EDS diagnosis. So a physical therapist who's really going to dive deep into the manual work, you're probably going to need more manual work than the average orthopedic patient. The fascia is thicker. It takes longer to work on. The next thing that, if you're watching this video, you probably know, not everyone, but a lot of people with the EDS diagnosis are hypermobile, or what's commonly called as double jointed. And something to be aware of is, even if you're watching this and you're an adult, you may think, oh, I'm not double jointed anymore. We do get stiffer as we age. And so if you have a history of that as a child, we still take that into account. And so a physical therapist who really understands hypermobility and is going to work a lot on stabilization and teaching your body how to move correctly and backing down your exercises. Something we see happen a ton is we jump to squats or jump to big exercises, but a patient whose EDS has been compensating their entire life. We know with hypermobility, you have weaker core muscles, you have decreased proprioception, which is a sense in our joints that help us know where we are in space. And so you've been compensating your entire life. And so we need to teach you how to access those muscles that your body may not naturally be accessing. And so a physical therapist who's really going to look at your form, really make sure you're doing things correctly, and really spend one-on-one time with you instead of just giving you a list of big exercises that may continue to harm you. We are also aware of the POTS and dysautonomia piece that can come with EDS. Now, when you're looking for a physical therapist in your town, you may not find one who has a ton of experience in this. They might without realizing it, but this is, like I said at the beginning, a newer awareness that we have in the medical community. So the most important thing is finding a therapist who's willing to treat you as an individual and research the condition, even if they don't have a ton of experience with that condition. Working with you on the dysautonomia piece, so that can look like body brushing, that can look on teaching you how to regulate your body and teaching you how to check in with your body. We find that a lot of our patients enter a boom-bust cycle. And so what that can look like is, I'm doing great. I knock out all these projects at work. I went on family vacation. And then where some people may just bounce back from that, you're down for a month. You're not feeling yourself. And so that's the bust. And so part of our jobs is to teach you to find, what is your capacity? What is your normal? How can we slowly increase that, but avoiding a boom bust cycle so that we can always function at a great level here instead of going really high, really low, really high, really low. And so we really need to look for medical providers for you that are going to look at that whole picture. That's why we have counselors in our clinic. That's why we have nutrition. That's why we have physical therapy, because when you have a whole body diagnosis, again, just PT or just your doctor is not going to be able to help you reach your optimum function. Those are some things just to consider with EDS. It is so much more than this short little video, and it affects every single person differently. So please hear me say, this is not medical advice for you. This is advice on what to look for in a provider that can find you, meet you where you are, and help you reach a better level of function and hopefully get out of that pain cycle. Comment below what you want to know from a PT perspective on EDS, and we would love to have a conversation about it.